Welcome to the Basic Obstetric Ultrasound Training Course for Healthcare Providers. Ultrasound plays an important role in identifying pregnancy-related conditions that put the mother or fetus at risk during delivery. In most low-income countries, there is a shortage of people experienced in performing pregnancy ultrasound. This course was created to train healthcare workers to perform basic pregnancy ultrasound in parts of the world where formal training is not available. The videos, as well as other educational materials, available at tinyurl.com/UWultrasound, are designed to be used in a 2-week ultrasound course. The hands-on sessions in the trainer's guide are an essential component of this course and must be supervised by an experienced ultrasound practitioner. This is not a comprehensive pregnancy ultrasound course and does not result in an official certification or diploma. After you finish the course and pass the written and practical tests, we strongly recommend you have at least 40 hours of scanning experience with clinical mentoring before you undertake unsupervised scanning. My name is Dr. Christina Adams Waldorf, and I will be narrating this 17th video in our Pregnancy Ultrasound series. This video will focus on fetal anomalies, also called birth defects. Please visit our website for access to all of our video and training materials. In this course, we will teach you how to identify some important abnormalities. Many abnormalities cannot be seen by ultrasound or are difficult to see. Therefore, we do not expect you to identify all abnormalities on ultrasound. Some babies you scan may be born with abnormalities that you did not see on ultrasound. This does not mean you made a mistake. We are also not able to teach you in this course how to identify all fetal abnormalities. If you identify a fetal abnormality, always refer to the hospital, even if you are unsure. It is more important to make the right referral than the right diagnosis. These are the abnormalities which we will discuss in this lecture. Anencephaly, exencephaly, which is an early stage of anencephaly seen in younger fetuses, ventriculomegaly, hydronephrosis, cystic hygroma. Please pause the video now to practice saying each word with your instructor. First, we will discuss anencephaly. Anencephaly is a condition in which the skull and much of the brain is missing. This is very rare. There is no chance of survival for the fetus. The cause is unknown. A fetus with anencephaly appears similar to the image on the right, which lacks a brain and part of the skull. On ultrasound, you will see these features: no visible skull, no brain above the level of the orbits, which are the eye sockets. The eyes appear unusually prominent, as if they are bulging out like that of a frog. There is often polyhydramnios, which means there is too much amniotic fluid. This is an image of a fetus with anencephaly. You can see that there is no brain or skull above the level of the eyes. The skull does not cover part of the brain. The eyes appear quite prominent or stand out. Here is an example of a normal fetus and one with anencephaly, as seen by ultrasound. Please pause the video now to identify the signs of anencephaly in the image. On the left, we see a normal fetus with a skull and brain. On the right is an image of a fetus with anencephaly. Notice that the eye socket, or orbit, appears prominent and that there is no skull above the level of the orbits. This is another example of a fetus in profile with anencephaly. Please pause the video now to identify the fetal body, face, and eye. Here we have labeled the eye socket or orbit, which appears more prominent than usual, meaning that it stands out. Notice that there is no skull or brain above the orbits. This is a transverse image of the prominent orbits or eye sockets in anencephaly, which appear similar to frog eyes. Now we will discuss exencephaly, which is an early stage of anencephaly seen in younger fetuses. In this condition, there is no skull, but some brain tissue is visible. The brain tissue degenerates over time, leading to anencephaly. There is also no chance of survival. Please pause the video now to practice saying exencephaly with your instructor. This is an example of exencephaly. There is no skull, but some brain tissue is still present. Please pause the video now to have a participant point out the brain tissue, fetal face, and fetal spine. Here we have labeled those structures for you. Notice the disordered appearance of the brain tissue because there is no skull. This brain tissue has likely begun to degenerate, and soon the brain tissue will no longer be visible, and the condition will be called anencephaly. This is a different case of exencephaly. Again, there is no skull and some brain tissue is present. Please pause the video now to point out the brain tissue, fetal orbit, and body. Here we have labeled those structures for you. The key to identifying exencephaly in this image is to see that there is no skull and some brain tissue is still visible. The next anomaly that we will discuss is ventriculomegaly, which means an enlargement of the spaces inside the brain that contain cerebrospinal fluid. Cerebrospinal fluid, or CSF, cushions the inside and outside of the brain. Inside the brain, the CSF is contained within spaces called ventricles. Please pause the video now to practice saying ventriculomegaly with your instructor. Recall that we identified the lateral ventricles in a prior lecture because they are important markers for us to get a proper scan to measure biparietal diameter for fetal dating. The lateral ventricles are best seen at level A. Here are two images of normal ventricles. The ventricles contain cerebrospinal fluid, and so the ventricles appear black. Within the ventricles, there is echogenic tissue that makes the cerebrospinal fluid called the choroid plexus. Here we have labeled the ventricles and choroid plexus that fill a part of the ventricles. The calipers measure the size of the ventricles. Normal ventricles are less than 1 centimeter in size. With the condition called ventriculomegaly, the lateral ventricles become enlarged and wider than 1 centimeter in size. This can be caused by a blockage in the ventricles or by a loss of brain tissue. There are other causes as well, such as infection. Lateral ventricles are located above the thalamus and are normally small. In these images, the ventricles are much larger than 1 centimeter, which we call ventriculomegaly. Here, the red calipers mark the width of the ventricles. In these images, there's also ventriculomegaly with very enlarged ventricles, marked by the red calipers. The ventricle on the left measures 2.4 centimeters, which is much larger than the normal value of less than 1 centimeter. Notice how the choroid plexus seems to dangle into the ventricle because there is so much fluid. This is a typical appearance for the choroid plexus in ventriculomegaly because so much fluid surrounds the choroid plexus. Now we will discuss a different type of problem in the fetus that you can see on ultrasound, related to a blockage within the urinary system. As a result, urine may back up anywhere along the urinary system. There are many causes of blockage. Babies with urinary blockage may need surgery or other treatments after birth, so this is an important abnormality to identify with ultrasound. In this diagram, we see a normal urinary system on the left side. Urine is formed in the kidneys and then travels down small tubes called ureters to the bladder. On the right side, we can see what happens when a blockage develops in the ureter. Urine begins to back up into the kidney, making it swell. This is called hydronephrosis. The area where urine collects in the kidney is called the renal pelvis. Here we show how normal kidneys appear on ultrasound, indicated by the red arrows. The top image is transverse, and the lower image is sagittal. Can you identify the urine in the kidneys? Please pause the video now to give participants time to identify urine in the kidneys. Here we have labeled the urine inside the kidneys with arrows. It is normal to see a small amount of urine in the kidneys. Because urine is fluid, it appears black. These images are normal. This is how kidneys will appear on ultrasound when hydronephrosis is present. These kidneys are blocked, so they are filled with urine, which will appear black. Hydronephrosis usually involves dilation or enlargement of both the lower and upper regions of the kidney. There are several things to notice about these images. First, notice the dilated renal pelvis filled with urine. How do we know that we are looking at a kidney? The small pyramids or ridges that project into the dilated renal pelvis are typical of the kidney. These ridges may disappear over time as pressure from the blockage slowly destroys the normal kidney tissue. Finally, notice the amount of kidney tissue or parenchyma that remains and surrounds the dilated renal pelvis. There is much less kidney tissue remaining in the left image than in the right image. In both images, the kidney tissue remaining is much less than in a normal kidney. Now notice that there is another fluid-filled structure in the right image. Can you guess what it is? Please pause the video now to discuss in the group. The answer is that this is the bladder. Notice the smooth contour of the bladder and the lack of pyramids or ridges that we see in the dilated kidney. Now let's review how to determine if a dilated structure on ultrasound is the kidney, the bladder, or even the fetal stomach. First, fluid collections in the kidneys usually appear near the spine. If you see small pyramids or triangle-shaped structures around the edges of the fluid collection, this is a kidney. Over time, hydronephrosis leads to destruction of the normal kidney tissue. The small pyramids and triangles will disappear. Finally, the bladder generally has a smooth contour. Which structures are we looking at in the upper left image? Please pause the video now and encourage responses. In this case, there is a blockage in the urethra, which allows the bladder to drain urine. So there is a backup of urine leading to enlargement of both the kidneys and the bladder. Notice the pyramids or ridges indicating the kidney and the smooth contour of the bladder. This image also shows how the spine can create a dark shadow that makes it appear as if the kidneys and bladder are connected. They are not connected. What do you see in the lower right image? Note that this is not a transverse image of the fetus. It is a coronal section, which divides the body into a front and back half. Please pause the video now to encourage responses. Here we can see two enlarged kidneys with hydronephrosis. The pyramids or ridges along the dilated renal pelvis of each kidney are your clue that these are, in fact, kidneys. The bladder may also become enlarged, often because of a blockage. If the fetal bladder appears unusually large, rescan after 30 minutes. If the bladder is still large, there's probably something wrong, and you should refer to the hospital. Please pause the video now to look at these images as a group and ask what the structure is and whether it appears normal. In both images, the structure is a fetal bladder. The bladder on the left is normal in size. Note the smooth contour and absence of pyramids or ridges like we saw in the kidney. On the right, you can see how the bladder takes up much more space in the abdomen and appears to be enlarged. Something is curious about the enlarged bladder in the right image. It appears to be connected to another dilated structure. This structure is called a keyhole, which indicates that posterior valves in the urethra have created a urethral blockage, leading to an enlarged bladder. There is another condition that can appear similar to hydronephrosis, but is quite different. In this image, we see a cystic structure within a kidney, but this time it is not hydronephrosis. Notice that there is a septation within the cystic structure. This is a cyst within the kidney, similar to the cysts that you might have seen within the ovary. Inside a kidney cyst, we don't see the pyramids or ridges that we identified with hydronephrosis. Now, let's use what we have learned to study a few cases of blockage within the genitourinary tract. Case number 1. In this image, we can see 4 cystic spaces. What are they? Please pause the video now to ask a volunteer to identify the structures in the image. First, we see the heart underneath the ribs. Both kidneys have hydronephrosis, but in this case, the pyramids and ridges are difficult to see because the condition has gone on for a longer period of time. Nearly all of the normal kidney tissue was destroyed. The bladder is the structure located closest to the baby's feet. Case number 2. This is an interesting image. Here the white calipers measure the length of the kidney, and within the kidney is a large cystic structure. Please pause the video now to discuss what this might be within the group. The answer is that this could either be a kidney cyst or it could be hydronephrosis that is chronic with a loss of the pyramids and ridges. Notice the normal kidney tissue that is present. Case number 3. This is a case with several cystic structures in the image. This image looks different because it is a cross-section of the abdomen, and we don't have the benefit of seeing the full length of the kidney to gather more information. What do you notice about all of the cysts in the image? They all seem to have a smooth contour. Please pause the video now to ask a volunteer to identify the structures in the image. The largest cystic structure in this image is the bladder, which is in the midline. The cysts located to either side represent hydronephrosis of both kidneys, which are located close to the spine. Case number 4. Here is an image from a younger fetus than we have seen in the prior cases. We see 3 dilated cystic structures. Please pause the video now to discuss what the structures might be as a group. The answer is that the large cystic structure is the bladder, and the smaller ones are likely kidneys, given their location next to the spine. There's likely a urethral obstruction, causing enlargement of the bladder and hydronephrosis. The last fetal abnormality we will discuss is cystic hygroma. This is a condition caused by a blockage in the lymphatic systems that usually appears as a cystic mass at the back of the neck or head. Often we will see other abnormalities together with this condition. Most fetuses will not survive. Cystic hygromas usually appear in the second trimester, and the masses can range in size. The mass is usually cystic, with thin lines or septations in the cyst. This condition is often seen with oligohydramnios, or low amniotic fluid. These images show cystic hygromas behind the head. Please pause the video now to have participants point out the cystic hygroma and associated features. Here we have labeled the cystic hygromas and pointed out the thin lines or septations that are often seen within the mass. There may also be low amniotic fluid or oligohydramnios in the case shown on the left. Here are 2 more examples of how a cystic hygroma might appear in a young fetus. In the left image, you can see a cystic mass behind the fetus's head. In the right image, you can see that the cystic hygroma extends behind most of the fetus's body. Let's practice using ultrasound images to identify these 4 abnormalities. Please look at image number 1 and guess which abnormality is seen in the image and name one associated feature. Please pause the video now. The answer is that the image shows an enlarged kidney, which we call hydronephrosis. The pyramids, or ridges, in this image indicate that this is a kidney. The structure with a smooth contour is the bladder. Hydronephrosis indicates a blockage in the urinary system. Now please look at case number 2 and guess which abnormality is seen and name an associated feature. Please pause the video now. The answer is that this is a cystic hygroma. Thin lines or septations are seen within the mass at the back of the neck. Please guess the abnormality in image number 3 and describe an associated ultrasound feature. Please pause the video now. The answer is that this is ventriculomegaly, which is an enlargement of the ventricles in the brain. A commonly seen ultrasound feature is that the choroid plexus appears to be dangling in the fluid. Now please name the abnormality in image number 4 and an associated feature. Please pause the video now to discuss within the group. The answer is that this is fetal anencephaly. There is an absence of fetal brain or skull above the level of the orbits. The orbits, or eye sockets, often appear prominent, like frog eyes. Let's review the algorithm for ultrasound as it relates to identification of fetal anomalies or birth defects. If a pregnant woman comes to your health center for a screening ultrasound at 20 weeks and it is normal, encourage her to return for another screening ultrasound at 32 to 36 weeks. If you suspect a fetal anomaly at any gestational age, send her to the referral hospital to be rescanned. The obstetrician at the referral hospital will decide when the patient should come back for antenatal care and a repeat ultrasound. Let's review the key points. There are many fetal abnormalities, but you should be familiar with anencephaly and exencephaly, ventriculomegaly, hydronephrosis, and cystic hygroma. If you identify an abnormality, refer the patient to the hospital, even if you are unsure. If a baby is born with an abnormality that you did not identify by ultrasound, this does not mean that you made a mistake. Many abnormalities are difficult to identify by ultrasound. So don't assume you made a mistake if one of your births involves an abnormality. Review questions, true or false. All anomalies can be seen on ultrasound. The answer is false. Many anomalies cannot be identified on ultrasound. What is the condition called where a fetus has no skull or visible brain above the orbits? The answer is anencephaly. Does ventriculomegaly affect the fetal brain or the fetal kidneys? The answer is the fetal brain. What can happen if there is a blockage in the urinary system? The answer is that urine can back up, causing a urine collection in the kidneys and kidney damage. This is called hydronephrosis. What is a cystic hygroma? The answer is a cystic mass at the back of the neck caused by a blockage of the lymphatic system. Thank you for your attention and interest in learning pregnancy ultrasound. Please pause the video now to ask your instructor any questions about this course. We thank the following individuals who played a major role in course development: Dr. Robert Nathan, Dr. William Marks, and Nicole Goldsmith, registered sonographer. Many other individuals contributed valuable time and expertise in the instructional design and materials development, including Dr. Christina Adams Waldorf, Dr. Scott Barnhart, Dr. Michael Kawuya, Susan Kingston, and Stacy Lissett. We also wish to thank Dr. William Marks for the use of images from his book, Ultrasound, A Practical Approach. We thank Dr. Sidney Gosby for consultation, and Jennifer Summers and Jan Hamanishi for graphic design. The University of Washington Department of Radiology has used this ultrasound course to train healthcare workers in many parts of the world. If you have questions about this video or course, please contact Dr. Robert Nathan, Dr. William Marks, or Dr. Christina Adams Waldorf. This course was collaboratively developed by the University of Washington Department of Radiology, Obstetrics and Gynecology, and the International Training and Education Center for Health, ITEC. It was made possible through a grant from the GE Foundation. Consano also contributed funding. We are grateful for the video production sponsored by the University of Washington Institute for Simulation and Interprofessional Studies. Please visit our website to access all of our training materials. This material is copyrighted. You are permitted to copy, distribute, and post to websites. You are permitted to modify the content to adapt to specific populations and user needs on the condition that you include attribution to the University of Washington and retain any copyright notices and citations and attributions included in the original Basic Obstetric Ultrasound training course for midwives. The material in this video is provided for information purposes only. The University of Washington Institute for Simulation and Interprofessional Studies does not take responsibility for the accuracy of the content in this video.